Okay, hi everybody. I'm Dr. Liz Corcoran.
I'm Carrie Bartlett.
And we're from the Integratis Clinic. We just wanted to join you guys quickly today and talk a little bit about therapy, in particular therapy for kids, child, adolescent, and how a professional like myself or a GP, how do we kind of decide that a child might benefit? And then how do you guys as parents, as carers, how do you kind of think about, hey, my kid might benefit? So Carrie, could you educate us a little bit from a child and adolescent psychotherapist point of view? What kind of things do you encourage us to look for when we're thinking about kids who might benefit from a time coming to see someone like yourself?
So I think it ranges.
Okay.
Some parents see quite obvious signs of, maybe their child's becoming more withdrawn. Maybe there's a lot of issues with sort of getting them to go to school. They might be showing some anxiety or low mood, after school or even at home. And perhaps they're not going to the clubs that they used to enjoy.
Okay.
So we do see a lot of children coming through the door with quite obvious symptoms of something not being quite right.
Yeah. So stuff they were doing before,
Yeah.
they're now not wanting to do.
Yeah.
They're wanting to cancel activities, withdraw.
Right.
Okay.
They might be spending more time in their room. They might be sleeping more. Their eating habits might have changed. And we do see a lot of children who are having quite intense emotional meltdowns. So
Okay.
those can be either quite angry ones, or they might be sort of sadder in quality, that they seem very low mood. But we also see children who perhaps the signs are a little bit more subtle.
Yeah.
So they might just be ruminating on things, stuck in their own mind a little bit, or they might have quite negative self-belief. So perhaps there's something going on with their confidence. And then we see, we do see peaks of certain times of the year, exam season, which I know we're in right now.
Yes.
So shout out to our teenagers and to our year sixes and anyone else who's sitting exams right now, because it's really stressful.
Very stressful.
And I don't love the word triggering, but it can be a trigger point during this time of year. And there might be times when people want to come and see us almost as a preventative measure. So I'm thinking specifically of year sixes. They might be leaving primary school, they've been there for a really long time, moving on to secondary school, and some people seek out our help to guide that transition, to create a neutral space where we can think about it and support what's going on for that particular child.
Yeah. And the other thing I'm thinking a bit about is times when families are going through difficulties, parental separation, divorce, and also bereavements. Our grandparents may be passing away or other important family members.
Yeah.
They can be a time when kids' behavior might begin to be troublesome and difficult to sort of navigate for parents.
Yeah. And I think the important thing to note about those, what we call some major life events, is the child might not be overtly showing any signs. How many times, I'm sure you see the same, how many times we see parents, concerned parents coming through the door but saying, well, our child seems kind of fine, but when we scratch the surface a little bit, we notice that actually they're just, holding it together, and or it may be after the fact. It can be, it can be years after a significant bereavement or a parental separation.
Yeah, and sometimes kids can kind of withhold their processing of difficult times until they see maybe the parent begins to be functioning a bit better, and then it's sort of they begin to kind of show some of the signs that they need a bit of support and help. Well, I really want to encourage you out, if you're thinking about getting in touch with us, there is no shame in having therapy. I've had therapy, you've had therapy.
I'm still in
therapy. Yeah. It's probably, I would say, the best money ever spent, investment in yourself, in your mental health, and same for your kids. So get in touch if you want to have a word with Carrie or myself about the services we have at Integratis, and we hope to see you soon.